Welcome everybody. My name is Drew with the Ohio Council for Home Care and Hospice, and we want to thank you very much for joining. I am the Director of Communications here at the Council, and I have the privilege of opening up today's webinar, which is going to be very exciting. We love technology, and our guests from Odessa Connect and their partners are going to be telling us about some amazing connectivity that they can tell you the details better than I, but it really solves the problem of bringing care together. And with us to start things off is Greg Kenny with Odessa Connect, and I will hand it over to him. He's going to introduce our panel today. A few little bits of housekeeping, of course. We do have the Q&A feature enabled on this webinar, so please, if you have questions or comments, click on the Q&A icon on your screen and enter your comment there. We also have the chat if the Q&A isn't working for any reason. And you can also use your responses. There's the raise your hand feature. If at any time you would like to be noticed for any reason, we can then find out what your question is or comment. Also, there's reactions. If you want to throw out smileys or other emojis, they're always fun. So feel free to do that. So absolutely afterwards, we can also follow up with contact information if a question occurs to you after the webinar is concluded. So with that being said, I hand it over to Greg.
Thank you, Drew, and welcome everyone. I am in Knoxville, Tennessee. I'm the Chief Innovation Officer for Odessa Connect, and I'll be facilitating our discussion today. It's going to take on a panelist or panel type format where I will ask some questions and our attendees will respond. But please don't hesitate, as Drew said, if you have questions along the way, just drop those into the chat or into the Q&A section, and we'll get to those as best we can. I want to try and get through my intros as quickly as possible so we can get into the meat of our discussion today. But again, thank you for attending on this very cold day here in Knoxville, at least. I will first want to introduce Christy Carey. She is the Senior VP of Clinical Operations for Accord Care. She's a member of their leadership team. Accord Care is a large, privately held home care company based out of Marietta, Georgia, that operates in 8 states. Christy has over 20 years experience as a registered nurse and has spent her career in clinical and operational roles. Her focus is ensuring that individuals have the opportunity to be safely cared for in their own homes. We also have Jasmine Satterfield with us today. She is the Community Outreach Director for Senior Care Partners of East Tennessee. SCP is a geriatric primary care office that offers patients a multitude of options, including in-home visits and memory care. Jasmine is a registered nurse and has served seniors in her community for almost 15 years. Her passion for senior care extends further into the community by the way of her volunteer efforts. She serves on the board of directors for Hearing and Speech Foundation and director of the Blount County Senior Resource Network. So welcome, Jasmine. And then Stephanie Blair is one of our own at Odessa Connect. She is our clinical advisor. She has 22 years of nursing experience and has a background in geriatric, palliative, and home health. Stephanie has an IT degree as well that has been instrumental in understanding and implementing technology-based solutions. And she's worked closely with senior care partners to support their efforts in adopting the Odessa platform. Again, I am Greg Kenny, the Chief Innovation Officer. And last not the least, I want to introduce Todd Smith, our CEO, and he'll tell you a little story about the company, how we got started, and then we'll get into our panel discussions. Todd?
All right. Well, thank you so much, everyone, for joining us and spending some time with us today. Thank you, Jasmine, Stephanie, and Christy, and Greg for participating, and to the Ohio Council for hosting. I'll just give some quick backstory on Odessa for context. The big idea behind Odessa Connect is really just how do we make technology simple for our older people that we care for, our older patients, our older loved ones. Probably we would all agree that technology can be frustrating, intimidating, off-putting, not inviting to an older person who did not grow up, clutching an iPhone like our kids did. These systems, these devices are not intuitive. for an older person generally. Obviously, the screen size is a problem. So we really tackled this as a design problem. We have a mantra here at Odessa Connect: never blame the user. We even see the users sometimes blaming themselves, and you'll hear things like, I'm no good at technology. That stuff's not for me. I'll mess it up. I'll break it. This is just resistance in the user experience due to the fact that the interfaces and the devices were not designed for older people. So we approached this as a design problem, and we spent several years in R&D and pilots. We did a lot of pivoting and iterating, and that journey led us to the TV screen as the magic that made it all happen. So it's sort of obvious in retrospect, but if you think about it, the TV is large format, first of all. Everybody has one. It's on for many hours a day, for better or for worse. And the person is right there. So we're coming to the person with our content, with our programming, with our connection, instead of asking the person to come to a device or an app or some sort of digital interface where that is not friendly or intuitive. So leveraging the TV screen in the home, we found, is a very effective way to reach our older patients digitally as an alternative to, an app that you have to download and a password that you have to remember and a screen that you have to tap. So that's the big idea. And we are based in Louisville, Kentucky, from the senior care ecosystem here. And we started in senior living communities around Louisville and the region, installing our Odessa system into the rooms and allowing the residents to not only get announcements from the staff and view dining menus and activity calendars on their TV, but also communications from the family. So photos from the grandkids that come up on the TV, video calls from family members. So we're using the TV as a two-way portal, the way you might use a phone or a smaller screen, but allowing our older patients and loved ones to do many of those same functions on the large screen through the TV, through the Odessa kit. And then over the last year or so, we started expanding out of the senior living setting and more into aging in place at home, and working with home health providers and geriatric primary care providers to engage their older patients who were at home, not in a facility setting, but now we're literally in the living room, patients sitting in their comfy chair on their couch and clicking their Odessa remote and talking to their doctor or their home care providers. So lots we could go into there in terms of the features and things, but I'll stop there, and we can get into our discussion.
Great. Thanks a lot, Todd. So our objective today is really to help the attendees gain a better understanding of how the Odessa platform can be leveraged to improve not just operational efficiency, but how to generate revenue, how to engage with the patient, even improve the life of the care provider, but ultimately to get better outcomes and fill some of those gaps that we have in our healthcare system. So I'm going to first turn this over to Christy. I'm going to ask her a question, and then we'll come back to Jasmine. But Christy, you're at Accord Care, and could you just give us a brief background about Accord and what led you to select Odessa for your virtual care platform, and maybe a little bit of how you're using it?
Yeah, we consider ourselves to be a very innovative company, and we are always looking at ways to improve clinical outcomes. That is one of the primary things that we talk about in our meetings every week is what are we doing? How can we do it better? And I knew that we needed to add technology and had a lot of different calls with vendors. And when you say I'm looking at adding technology, it could be anything because there's such an array of things out there. So I really had looked at different things and had actually gone to a home care technology conference, which they don't have anymore. And I wish that they did. But so I went to it was the one-time conference that they had. And I met these guys there and just absolutely loved the product and thought that it would be something that would be great to use. And I was really interested in using technology for us to solve a few problems. One is knowing that there is a workforce shortage that's only getting worse. The only good thing we can say that came out of COVID is really the thought of home care has really amplified in everybody's mind that that's where you want to be and that's where you want your families to be. I feel like much more than ever before. But then that also means all these folks wanting to stay home, you need people to care for them. And the ability for us to provide all the caregivers that people are looking for, that's already a challenge for us and is only going to be more of a challenge in the future. So I wanted to look at something that could help with a workforce shortage, would still allow folks to stay at home. Could I find something that I believe could actually lower the overall cost of care for our clients? And then could that also, and this was a big ask to do all three of these, but could it also improve our clinical outcomes? And that's really what led me to working with Odessa. I think the product that we have is doing that. So I'm anxious and I'm really excited to be able to talk to y'all more about that today.
Well, thank you for that. We'll come back to you. And I want to ask Jasmine really the same question. Jasmine, kind of tell us your journey. What led you into virtual care? Is we all know the struggles of workforce, not just a dwindling workforce, but turnover, increasing population, demographically, just the aging adults, and just not enough folks really to care for them. So tell us about your journey and tell us how you're leveraging the platform in your environment.
Yes, thank you. So as we know, our senior population, our baby boomers haven't even boomed yet. I'm not sure if any of you saw recently where there was actually a senior couple who booked cruises for a whole year, and it was cheaper than assisted living. So to me, that is a cry that says home care is, one of the most important things going forward in the future. And we have a lot of homebound seniors within our community. Within our practice, we try to create a network where once our patients can't come to clinic anymore, we transition them to a home care program where a physician, a geriatrician, or nurse practitioners go out to see them. Well, it's not really feasible for a physician, especially in the county size that we have, for them to be able to go to every patient's home. So we needed a dependable platform that we could use, that our seniors would be able to use, but then also that we could call at any time if they were having an acute need, or if they had just a routine follow-up to see if this new prescription was working. And so we were encountering lots of difficulties with that. We found difficulties with HIPAA compliant platforms, patients not being able to access their email, not having an email. There were just so many things because it was multiple steps that we were having to take to get patients logged into our meetings. And so we reached out. We were looking for, a vendor or a source of a platform such as this. And Odessa Connect we were connected with you all. The way that we're using it is we're using it for chronic care management. We also are using it for routine follow-ups, acute visits. We have a 24-hour on-call system. So it really helps the provider if when this patient calls and they need a visit, that they can actually see this patient face to face and they can have a true telemed visit. It's the difference oftentimes in reimbursement from the difference of a telephone visit, which has very low reimbursement rate for our providers, to a face-to-face visit. But then also, you know, a picture and video is worth, picture's worth 1,000 words, video's worth 1,000,000. And you can see actually what's going on. You can see if their face looks puffy today versus yesterday, if you're following your congestive heart failure patients. So I highly recommend the program and the system, and it's really done wonders for our office.
Good deal. So I'm going to ask this to both of you. The technology is, as Todd said earlier, is often hard to adopt, and particularly for the older population. So how has that been for I come from the healthcare system about 20 years myself. Stephanie Blair and I actually worked together at a medical practice. And I remember the challenges of adopting electronic medical records, both on the provider end and, patients' adoption of patient portals. And then when COVID hit, having to adopt virtual, technologies in order to conduct the visits. And it was a real barrier, I think, to care. But how has this experience been for your patients compared to maybe other platforms? Why don't you go first, Jasmine? You just go ahead.
Okay. Well, in the beginning, we did hit some hesitancy because just as you all were saying previously, this population has already built a roadblock for themselves that they say, this technology, I just can't do technology oftentimes. And so it was just talking to them, as their healthcare provider, you have a trust relationship with your patient. So often it's the physician saying, this is important to you. It's really going to help you. These are the reasons, this is the benefit that you're going to get from this. But then also, being able to show them how easy it is. Once a provider uses it and they see the ease with which you can, you can work this system, the providers are going to want to lean this direction as well. And so, with that trust relationship with your office, you can establish, you can say, hey, we found this. And it makes it much easier. So generally, that's how we've encountered, or we've come across that roadblock, and how we've gone through it.
Christy, can you chime in a little bit and tell us how adoption has gone on your side?
And for clarity for the folks that are listening out there, and this is one of the cool things about Odessa and the system, and they collaborate with each company and what they need and understand their vision. So I will tell you that the way I use Odessa today versus Jasmine, we're in some ways, there's some things that are similar and some things that aren't, because our businesses are really two different businesses. So I think this is something that can be relevant for everybody. As I was talking to different vendors and looking out at the technology, a lot of what I saw are sensors and listening devices, usually like through Alexa and different things like that. And they definitely have their place, and they've got some great outcome data that they can show you. And I do believe that in the future, there's going to be a real future for that, because all of us have this sitting beside them right now. She's listening to us, and none of us mind. But I will tell you that most of the folks that we're working with, our clients are 75 to in their 80s and in their 90s, and many don't even have Alexa in the home. I had a conversation with somebody literally this week. I am not having that in my home. They are not listening to me. So convincing people to put this in their home is easier, just for the fact that it's really the TV, and the only thing that your client has to get used to, it's just a new remote. And Todd had put it up before. It is the most basic remote. I explain it to people, like our dashboard and everything. It looks like, Nickelodeon made it, the Nickelodeon in the day. If you remember that, the old Nickelodeon, it's bright colors, it's aesthetically pleasing, and there's not an intimidation factor to it. I actually rolled it out very recently. I had gone to a home and that person had some dementia, and I actually was worried about, is this going to work with this person? And we had no problems with it. She grasped it, she understood everything, and you almost feel like, and initially I had thought, oh, because there's the video component of it, that part people are going to be a little bit uncomfortable with, but I just haven't seen that. I've not seen one person that was uncomfortable with the video component. You know, everybody asks you, can it turn on and they see me? And when no, absolutely not, let me explain how it works, then they're fine with it.
That's great. That's great. So there's always, you know, two sides to the coin. How, this question is to both of you, how have the providers really responded to this? When I was working in a medical practice, there was so much cognitive load anyway with electronic medical records, and then to get into telemedicine and all that, it was maddening, I think, to our providers to have to deal with that. So I'm curious, how has the adoption of the technology been for the providers? Jasmine, do you want to respond?
Well, through the Odessa platform, it's really easy to log in. So our providers have found it to be much easier, instead of the, can you hear me? Did you push your camera? Did you do this? And all that go along with trying to use a cell phone or a tablet that some other agencies might offer. And so with this, literally you just log in, it's got the patient's picture there, you click it, it opens it up. I've been in the patient's home when they received a call from their provider, and the ease is just the same on the recipient's end. It rings like an old telephone, so it's very nostalgic. And so it rings, you can answer it or not. You push the green check mark and it answers, and your provider literally just pops up on the screen. And so for the provider and the recipient, it's super easy. It's literally, you push a button as you're logged into the system. They've really made that the easiest it could possibly be. So for providers, it is often a relief to see that this patient has Odessa installed, because it's a very quick log in and click the link, and it'll start ringing immediately on their television.
Great. Christy, same question to you.
Yeah, and for us, we're using it differently. So we have talked to some providers about it, but we are not engaging providers with it today. We told them that they have the option, so we're using it differently, and we're using it in-house. So it's our clinical team connecting with our clients in the home.
Interesting. Now, are you using it to submit any screenings to folks in the home at this point?
Yeah, so that's exactly what we are doing. Our clients they do a daily screening, and then they do a weekly screening. So in the daily screening, they're answering 3 or 4 different questions. And then the weekly, they do a little bit more. The daily questions, we're looking really for any health concerns. And the weekly questions, we're also bringing in SDOH. So we're really looking at food insecurity, isolation and loneliness, that piece as well, medication adherence, all that stuff. So daily, they will answer those 3 or 4 questions. It takes them seconds to do it. And then we have really enjoyed the feature that we have, that it'll ask question 1, and then the answer will be yes or no. And I have worked with Odessa to say, this is what I'm expecting the answers to be. So if the answer is this, I don't even need to know about it, because that's what I think that they're going to say. Odessa, I have a dashboard. It is alerting me if it's telling me something that I didn't expect to hear. You didn't take your medications in the last 24 hours. You fell in the last 24 hours. Then that alerts my wellness team. Oh, somebody needs to be reaching out to Miss Jones and find out what happened.
I gotcha. So,
Yeah.
so kind of the journey, as I call it, on the patient side, they turn on their TV and they'll see like a survey question almost come up, and they're using the TV remote to respond to that.
Yes. So, and I actually have it behind me, and it's not a prop. It stays there all the time. And on the box that he he held up, there's a little orange light that lets them know, oh, I have a message from somebody, I need to check it. And then they will just match the button on their remote. And then it will bring up those questions. So it's very easy. They don't have to stay on. They can go on at their leisure, and actually Todd is showing it now. So I would see the little orange button, or the orange light, I'm sorry. Oh, and I would just take my remote, press the start, and then that would come up. This screen looks a tiny bit different from mine, but it says screenings, and he's got new, so I can see that there's screenings on there. So there's daily questions and weekly questions, and that's what they're answering for me. And I will tell you, so he's showing you my first question, and I honestly feel like this is the most important question we can ask, and that's, how are you feeling today? Because ask anybody that, sit down and take a while. But if they tell me that they're feeling worse, so if they feel the same, fine. If they feel better, great. I need to know if you feel worse, and then I'm able to call you right away. That allows us to catch UTIs that are brewing, all the different little things. Or another real life example is somebody was running out of Klonopin, which is a very strong drug they've been taking for 10 years, and they didn't have any more doses of it. Well, they were going to end up in the ER, probably in the hospital. That would probably have been her track record. And we were able to prevent that by her just answering the question.
Have you, probably too early in the game, but one of the things that we're kind of ideating around in Odessa is that connection with family members.
Yes.
I'm going to, kind of ask this of both Jasmine and you, Christy. I'll start with you, but do you have any family members connecting who also are maybe have access to the information and knowing that, hey, my mother checked in today and she's doing better or worse, or have you explored that yet?
Yes. So we say we have two sides to the system. So we have the side where I was just talking about it and you saw on the screen, but there's also family communication. So when I talk about, we're really interested in the SCOH and that isolation and loneliness, which we know statistically puts people in the ER because they're lonely. And we're trying to avoid that piece. But what's really cool is there's this whole other side of the system, and the families can connect by an app on their phone, and it's very easy for them. And one of the great things for myself and the companies is I just need to connect the first person. So I connect Greg with his mom, show him how to use it. And then Greg has all the power in his hand to connect everybody else. I don't have to keep up with it or anything. And they're able to have those communications too. So if Greg wants to call his mom, he can call through the system. And I will tell you, I've had a lot of people say, it's not really different than FaceTime. And I say, let me show you. It is a lot different than FaceTime. When you see your mom and you see this little bit versus really it's going to look like this. You see your mom, most of her body all around. I know Jasmine appreciates that too. So the person says, I'm feeling well, and it looks like a bomb went off and they've not been out of the bed in 4 days. It tells a lot. So I'll throw it over to Jasmine now.
I love that.
I agree. Especially, because you get the whole picture of the room. So those social determinants of health, a lot of times you just, because all of a sudden now you're in their home as a clinician and as a nurse, you can see what's going on around them. When you're talking about their chronic care management and their diabetes, and you see they have Oreos on the table beside them, it's very easy to see what's going on in their home, because essentially you're brought right there to them. We actually had one family that the patient, once we got Odessa installed, she really just wanted to use it to talk to family and friends. She was like, this is great. So, there is that aspect of it. But the ease with which it's used really does lend itself to family and friends using it. They can very easily log in through the app. I've sent the invitation to family members. It goes through as like a text, and they just click it and then download everything. Mm-hmm. Super simple and easy, and you can check on your loved one anywhere you are.
Yeah, and I want to add to that. So they can do the video. So it's really sort of like doing a Zoom call like we're on today, but it also, the families also have the option to send messages. So really they're just on their end, they're doing a text, and they can send photos. So what I tell my families is, and he showed now what a message would look like. And then what's really cool is if that person, you've received the message and mom wants to respond back, there is no keyboard or anything, but on the remote, there's just a button down. If Todd will mash okay to respond thumbs up, then it's going to say that you can, if you want to respond back, you just mash the button, you just mash the talk button. And so what's really cool is, and I'll use Greg example again, when Greg gets that message back from his mom, it's going to be an audio message. And how great is it to get an audio message from your mom instead of just the talk back? And then they can also send photos. And what I encourage families to do and would love to see is that they connect to everybody. So this family member, this client who's 95, who's been at home, fairly isolated, the family's doing the best that they can do, but now you can expand their network out international because it can do anything. You can expand them everywhere and they can connect with all of their family. And if it was in my loved one's house, I would have my sister's doing it on Monday and Thursday. I'm doing it on Tuesday. And your mom could be constantly bombarded with it without it even being stressful for anybody. And that will really help with that isolation and loneliness piece.
Love that. So I'm being pinged right now to pull you in, Stephanie. Do you have any comments? I know you and I've talked offline just about the value of bringing in family members, but anything that you want to add to the conversation at this point?
Yes. I want to just, back them up and saying this is probably the most easy, friendly system for our seniors. The transparency, as they were saying, like you can see the social factors in the home. Upon install, which I've done a few installs for senior care partners, which I absolutely love. You can see that transparency, which you can't see in an office. You can't see on a visit call. Also, the camera itself is removable from the TV. So if you're doing wound care, they can show you what that wound looks like today. And without you having to go out and see it or get a description of it, you can actually see it. And it's not a phone you're trying to position or a computer you're trying to position to see this wound. Very
and no
easy,
concerns
very
with
small
HIPAA.
camera.
Yeah, you're not concerned with HIPAA either.
You're not concerned with HIPAA, exactly. Security, my IT degree is in cybersecurity, defense. So obviously security is at the top of my list. Including that, it's a reliable source. We're all dependent on either the daughter's phone, the son's phone, a caregiver, which, could be a different staff member that are changing out each shift because they don't have, either they just have a landline and they don't have a cell phone. So this TV is always there with them. It doesn't matter who's there with them. You've got this direct communication instead of you trying to figure out, okay, who do I call today? Who's with them today? Who's with them at this hour? So I can make this visit occur. So I've known most providers, you spend more time trying to connect than the visit actually occurs. So I just wanted to, emphasize the importance of that and why Odessa stands apart from all the other like telehealth or any other platform. It's because the TV is always with them. No matter if they move, it goes with them. And you don't have to be dependent on a family member or a staff member.
Great point. Great point. Well, listen, I want to ask one more question of both Jasmine and Christy. Christy, I'll have you go first, but and then we'll open it up for just general question answer time. As a home care agency, Christy, what are some things that you would share to other agencies on the rollout of any kind of virtual care platform? I mean, any lessons learned that tidbits of wisdom that you could share with the group?
Oh, well, let me give you some wisdom. And the first wisdom is spend the time getting buy-in from everybody and then really understanding what your goals are and what the outcomes you're expecting to see. You can still move fast. I typically move, I feel like I want to move a little bit too fast, but getting buy-in from everyone within the organization, from your C-suite, but the folks on the field that are going to be out selling it, talking about it, or it will affect them in any way, that they really understand it. Even in that pilot phase. So a lot of times in the pilot phase, you think like, okay, I'm just going to do these, it could be these 5 or 10 homes, and I'm just going to really control this myself. And you really could still do that piece, but you really need to make sure that everybody is bought into this and is understanding the value.
Mm-hmm. Okay, great. Jasmine, what would you say?
I would say very much the same. Make sure that your staff is aware of all the functionality and they can really talk up the product and be able to uh, give an informed representation of what you're actually providing. But then also, once that provider talks to the patient and the patient has verbalized their intent to take part, then very quickly get onto the spreadsheet with Odessa or whatever communication you are, because they'll actually reach out to the patient then and have a communication with them so that it's still fresh in their minds. You know, sometimes this population has a very short recall time. So you don't want to let a long period of time go between when you talk to your patient and they give you their verbal consent, then when you reach out to Odessa to let them know. So try to make that process as short and seamless as possible so that that it's still fresh in the person's mind and all of the wonderful things the provider has just told them.
Great. And lastly, Stephanie, do you have anything you'd like to add?
I will say that, they say that, technology is a bad word when it comes to our seniors. I've seen, a lot of reluctancy when you come in with this box. Their biggest fear is you're going to mess up their TV channels, or they can't see their movies the same way. But I've seen once, they see it, they can finally communicate with their great grandchildren. Their great grandchildren can send them text messages, pictures. They don't have to be dependent on somebody else's phone to do a FaceTime. That gives them all this independence. So I've seen where it's like, how many family members do you want me to add while I'm here? I would just add this one. You'll show them how to add more. They're like, oh, I'm not going to use it. A couple days later, they're calling back. Tell me again, how do you add more? I got 15 more family members I need to add to this. So, it's intimidating to begin with, but once they see the ease of it, the security of it, it's not watching them all the time. They're like, oh, yes, I need more of this, especially when it comes to communicating with family and the ease of seeing their provider.
Absolutely.
That's all I need to add there.
Okay. Well, listen, I've looked, I don't see any questions rolling in. I mean, we've had it, there's some that we've gotten offline that I can kind of use to grease the skids. I know nobody wants to be first here, but one of the questions is, do you guys do pilots? As opposed to, I mean, I know a lot of vendors, they want you to do long-term kind of commitments, contracts, and we certainly do pilots. Todd, if you're out there, I know you've got your screen up. If you can unmute, do you want to talk a little bit about the process of, I think that's actually our secret sauce, is our willingness to engage with people in kind of a pilot level. But if you could talk about that.
Sure. Yes, we love pilots. We love collaboration. We love feedback. That's really how we've built Odessa, is through collaboration, through listening, through feedback, through suggestions and observations. Because we can sit in the lab and have hypotheses and think, oh, wouldn't this be great? Wouldn't that be great? But it's where the rubber meets the road is in the home. So we might design something we're really proud of or we think is great, but then nobody cares, and vice versa. Something we never would have thought of in the lab would be obvious in the home. So those pilots are crucial. Again, why we really appreciate Christy and Jasmine, and anyone who's watching and is interested. Sort of no project too small, onesie twosies. Let's get out there. Let's do some installations. Let's get to know some patients. Let's try some different use case scenarios, and if Odessa doesn't have a feature that directly addresses a need, then let's talk about that. Chances are, as long as it's, doesn't violate the laws of physics, we could probably make it happen. So 100% in favor.
Thanks for that, Todd. We do have a question coming in from Holly. Thank you, Holly. What is the cost of implementation?
So great question. There's basically two components to the cost. So there is the hardware, which is the little box that plugs into the TV and converts the TV into a two-way portal. The remote, which can be programmed to the patient's television and operates Odessa. And then any medical devices, we didn't really talk about this, but Bluetooth peripherals which can capture vitals data. So depending on the hardware setup and the webcam for video calls, there's a hardware kit cost, and that can be a purchase or a lease. So just a monthly payment. And then there's a monthly payment per patient. And that we think is very reasonable and digestible. But again, it's not a fixed number. So we'd love to just talk with you offline and structure a plan for you and give you an exact quote to fit your needs.
I want to say something to that too for Holly that may be helpful for her. For us, and everybody would have different pricing. We have a two-tiered model. And so on our higher end, where we are doing these daily checks, and you have someone from my wellness team that's overseeing you every day, I feel like anytime you say the cost of anything, it's like, oh. But what I'm telling the families is it's significantly less than you paying for a nurse to come to your house 2 days in a month, and we're going to monitor your mom every day. So that's what's so great about technology like this. The costs are so low. And if you can get those clinical outcomes that you're looking for, you can really lower that overall cost of care. And once you have that data and can explain that to the families and they understand, even saving them on the copays and all the expenses of going into the hospital on top of the misery of going into the hospital.
Mm-hmm.
Great point.
Yeah, I will add to that. Senior Care Partners, they took the lease option, if I'm not mistaken. Jasmine, do you have any feedback on kind of the pricing, affordability to patients? Stephanie may also have some comments related to that.
Well, in our office, our patients are not paying for it. Our office is, because we're able to offset that with provider visits, because reimbursement rates for a phone visit versus a face-to-face telemed visit is different. And then also because we try to focus on our chronic care management patients, with that, then that comes with its own reimbursement and, things that go along with that. So within our office, for those patients, we found it within our budget to be able to provide that service.
So the billing that you're doing for the clinical services offsets your lease cost, your monthly cost of the platform.
Yes.
Yeah, great. Stephanie, do you have any thoughts?
I agree with Jasmine. I mean, if you're focusing on those chronic care management, getting your, reimbursement on that, it kind of, pays for itself. The cost is kind of taken care of. But again, going where, Christy was saying, how much is it going to cost for them to be in assisted living? How much is it going to cost for a caregiver to come out and check on you? I know some companies, it's, $100 a pop just to go in and make sure they're okay. You're not having to call the policeman to go out and do a welfare check. And the likelihood that they attend appointments, you've got those that have Alzheimer's, dementia, that they're more comfortable doing these visits in the comfort of their own home. That, they could be having a bad day and not wanting to go to their appointments. In doing that risks them as an ER visit, hospitalization, those co-payments and, their deductibles. So it kind of pays for itself. They're saving money on the long run.
Yeah.
And I'll say, I think you have to creatively think about it as well, because I think that this will end up being a game changer for the middle class who have a hard time paying out of pocket for home care. They want to stay at home, they need care, and they're concerned about how to do that. And I think how that works for a portion of people for a period of time, which could be several months to extend them staying at home, to several years to end of life for them staying at home. I think how you do that is have the conversation with them of like, let's do this daily oversight. And so we can jump in if there's a problem. So if I find out there's an issue, we are on the phone with their PCP and working to figure out what we need to do. But then there are people that are just going to need care in the home. And I can supplement that with, let me send an aide to your mom 2-3 days a week. Have them come in. Maybe that's going to be 4 hours, maybe that's going to be 6 hours at a time. And they are going to make sure your mom is up, her sheets are changed, they do a load of laundry, she has a really good bath, they make sure she has a great meal to eat, and she's really well taken care of. So you sort of have that comfort, and somebody's coming in 2 or 3 days a week. If you did that coupled with just this daily oversight, many more people could stay at home and would not need to go into a long-term care facility.
That's great. I'll add here too. I know we're running out of we've got about it looks like maybe 12, 13 minutes left. I would say, I have parents who are aging. I'm entering into that season of life where I'm becoming the caregiver. Everything that you have just said, Christy, totally resonates with me. And that's what my brother and I have discovered when we explored options. First step was we had to get my folks relocated to Knoxville, so that we could at least physically get to them. And we started looking at options. My dad's health conditions have declined, and he really needs that. He doesn't need an aide every day. He probably needs somebody to check on him a couple times a week, but just a daily check, through the TV set is huge. That it is a game changer. And, have you guys found, this is to both you, Christy, and Jasmine, have you found, how hard is it to really explain the care protocols? Because it really is different. You're using the platform to really create a different category of care, I think. And that, to me, I think it's hard to explain to people because they want to put you in a category, that pre-existing category. But if you run into any difficulties and kind of communicating what your strategy is?
No, really. Once they have a hard time understanding the concept until they see it. So explaining it to someone that I meet at a restaurant is a very difficult thing to do. Like, let me show you. Once they see a demo of it, they completely get it, and they understand the value of it. And I'll say one thing about the Odessa team too is, what we started on day one with isn't what we have today. And we're still continuing to work out things with them. There's a lot of ideas that we have that we would love to keep adding. So I feel like you're going to continue to see the system get more and more robust, but it's really good for us to get people in on the ground level of it, easy to understand. And then as we build that out, and I will speak to the home care providers that are on the phone or on the call, and really thinking about, we would love, we're all out doing sales and trying to get every client that we can. But if everybody wants home care, there's never going to be enough. There's just not going to be enough aides, home care aides, to take care of them. And this is really the supplement to help your staffing piece. And the other thing that I will throw, we've just started to look at, that even folks that are wanting to come on and maybe more of a difficult area for us to staff, and people, when they call home care, they want to come on that day, within the next day or two. Typically, they're not looking about a month later. So you're always in a hurry to do something. And we're looking at, I don't have anybody here for you today, or maybe you want 5 days a week and I only can fill 2. Could I put this into your home temporarily? I think that you're going to love it and you'll just keep it, but even put it in there temporarily, telling you, and I'll do the oversight to be able to capture that case and then not go look for another provider.
Oh, that's great. So, Todd, I know you just came back from the Consumer Electronics Show. jealous of that. But I mean, what is kind of on the horizon of virtual care as we close? Is there anything that you saw there, that you could share with the group?
Sure. What was really striking, of course, the Consumer Electronics Show is everything from, self-driving cars to little gadgets and everything in between. Just a massive technology show. And what was really striking to me was what we're going to call age tech presence. In the past few years, or say 5 years ago, that might just be like a small area and a few booths and a little trickle. But this year the age tech AARP had a small city block size footprint with tons of startups and technologies that they're featuring. So the age tech presence is massively ramped up, which is, it's exciting because it shows that tech is getting eyes on the needs that are quickly, emerging as the population curve slopes steeply upward. So that was my big takeaway. I mean, there's a lot of stuff coming out, but the one common theme that I kept seeing was, and I only know this because we lived through it, sort of learned the hard way. Um, Walking through the booth saying, "Wow, that's really cool. They obviously never tested that in the field." Wow, that's really cool. That'll never work. Wow, that's really it's really cool from a technology point of view, from an engineering point of view, because you've got a lot of really smart people dreaming up really cool solutions. But again, back to where the rubber meets the road, in the home, in the living room, the last few feet, from the hands to the brain, you can fail. You can have all the coolest upstream technology, but you can still fail if the interface is frustrating or too much friction. So we're kind of the opposite. That's really where we're focusing, is that last few feet to make sure we don't fail there. Because the upstream stuff is actually easier, right? Connection to the home and, back end database technology. But yeah, so that was my big takeaway. Lots of age tech coming, but still not enough focus on the last few feet.
Yeah, love it. So we come full circle with usability. Well, I want to thank the panelists today for participating and all of our attendees. This brings us to a conclusion. I think, Drew, you're going to share some information on how they can connect with Odessa.
Yes, fantastic. Thanks so much for the presentation. I know I learned a lot. I've seen the program a little bit, but not seen it in action. Thanks, Todd, for some of the live shots of the program there on the monitor. Yeah, after the meeting concludes this afternoon, I'll be sending out an email to everybody that's registered with a point of contact that everybody can reach out to, you folks at Odessa, and learn more. Obviously, I want to thank everybody who attended for making us part of your day. Your time is valuable. Thanks to all of our panelists for joining. Your time is valuable as well. If there's any last thoughts or any last questions, now is the time. But if hearing none, then we will all get about our business.
I think we're good.
All right, fantastic. And there will be a recording made available as well. Thank you, everyone, for attending and being part of it. Have a lovely Wednesday afternoon.
Thank you
Thanks.
so much.
Yeah, bye.
Bye.